So if you ask me that if I'm a diabetic, can I have fruits? My answer would be yes. Any fruits? My answer would be yes. You cannot say that a diabetic cannot have these fruits at all. A diabetic can have any fruit as long as the diabetic knows how much is the quantity and in the day where is he placing the fruit. And the third thing is that from the entire range of fruits which is available, what is to be emphasized more and what is to be emphasized less. So, a dogmatic statement that a diabetic cannot have mangoes, not okay. A diabetic can have mangoes as long as he knows that he needs to monitor the quantity, monitor the frequency, and a golden rule to be remembered is that fruits should always be taken as an input before the meal, never after the meal, which means it may be a very good idea to incorporate that fruit at snack time, at mid-morning time, or a time which is a gap between two important meals. The best time would be the snack time, or sometimes we can even use it bedtime. So which fruits to emphasize more and which fruits to emphasize less? Now there are two terms which any diabetic needs to understand. One is the glycemic index and the other is the glycemic load. What is glycemic index? It's the rise in the sugar which is caused by the consumption of a defined amount of carbohydrate which is coming from a food. And what is glycemic load? That means how much is the carbohydrate present in one serving of that food. Now let's apply this to fruits. There are some fruits which have a high glycemic index and a high glycemic load. So I would say like fruits like your mangoes, sapota, pineapple, grapes, these are all the fruits which have a high GI and they also contain a higher amount of carbohydrate. So such fruits need to be taken in very small quantity and always in between the two meals, never to top it on the meal either before or after. Now there are some fruits which have low glycemic load like papaya, like watermelon or any melon for that matter. So per serving the amount of carbohydrate they give is less, but the spike in sugar caused is higher. That means they have a high glycemic index. So if I'm a diabetic and I say because watermelon or because papaya has less carbohydrate, let me have a bowl full of papaya or a bowl full of watermelon, not a good idea. Because even though the carbohydrate content per serving is less, the moment I increase the quantity and the fact that the glycemic index is high, it may disturb my rhythm of maintaining sugars. Then we come on fruits which are the best for diabetics because they have moderate amount of carbohydrates and they don't also have a high GI. So which are those fruits? Fruits like apple, pear, pomegranate, guava. Okay, these are all the fruits which have moderate amount of carbohydrate and always we prefer to take them with the skin, with the fibrous part, so that that further blunts the spike in the sugar. And the golden rule in terms of quantity remains the same for all fruits. So it could be any fruit, but the quantity of fruit for a diabetic needs to be rationed. Now the question is, how much quantity? So to my mind, I think 2 fruits in a day is a good idea for a diabetic, but not more than 2 fruits in a day. Because going excess on fruits and going less on vegetable is again not something which is recommended for a diabetic. On a scale of 100, a diabetic must remember that my consumption of vegetable should be 60 to 70% and my consumption of fruit should be 30 to 40%. Another thing which needs to be remembered is fruit juices are an absolute no for a diabetic. Because fruit juices means you have eliminated the fiber, you have extracted out the simple sugar and you're putting it inside your body. So it is going to give us immediate spike in your blood sugars, which will disturb the rhythm of maintaining your blood sugars. Now this brings me to another point. As a diabetic, I need to understand what is going wrong in my body. The problem with me is that the body is not in a position to handle a given carbohydrate load, in a very effective manner. So as a result of which, the body inherently is not in a position to maintain the blood sugar levels. So the endeavor, the effort which I have to do as an individual is to help my body give the food in the right quantity, in the right format, so that I help my body maintain the blood sugars well. So that is why the message is always whole fruits, not more than 2 fruits. Always, even the 2 fruits need to be divided throughout the day, 1 in the morning, 1 in the second half, and never after the meal, immediately after the meal. Always preferred to have it as a snack, whether it is an evening snack or a bedtime snack. Always take the fruit with skin, with seeds, no fruit juices. And there is no barring that you cannot have any fruit or you can have only these fruits. It's just that you have to have the prudence to pick a seasonal fruit, place it in a scale of glycemic load, glycemic index, how much carbohydrate it has, to what extent it will increase my sugar, do I consume it with the skin, with in the natural form, so that the fiber also helps in blunting the sugar spike. So I have to become prudent in terms of picking my fruit, but definitely go for a seasonal fruit, monitor the quantity, place it right in your day, and never extract juice and have it in its most natural form, with the skin, with the seed, and get all the phytochemicals which the fruits have, besides giving you the fiber and the good sugars.